Hello, my name is Amy and I'm a nurse at PRMA Plastic Surgery. Today we are going to review everything you need to know prior to your upcoming surgery. It is important to listen to this video until the end. We also recommend writing down any questions you may have while listening to this video to discuss further with your nurse at your scheduled follow-up phone call. The date and time of your follow-up call with your nurse is provided in the email containing the link to this video. You are welcome to pause and replay this video as many times as you need, but again, it is important to watch this video to the very end. The date, time, and location of your surgery is provided in the email you received. There is also detailed information on parking information based on the location of your surgery in the links below this video. Beginning 6 weeks prior to your surgery, you must quit smoking, vaping, or use of any nicotine products. It is also important to avoid contact with any smoking areas. If you live with a smoker, please make arrangements for them to smoke outside through the duration of your recovery. 2 weeks before your surgery, you must discontinue taking any vitamins, herbal supplements, aspirin, any products containing aspirin, and any additional over-the-counter medications to include Advil, ibuprofen, Motrin, Aleve, and naproxen. Your nurse will go over your individual medication list with you during your follow-up phone call to ensure you cease taking any prescribed medications that could interfere with your surgery. Unless otherwise directed by your nurse, please continue taking all other prescription medications. Below this video, you will also find a link to a list of medications that should be stopped 2 weeks before your surgery. Alcohol use must also stop about 2 weeks prior to surgery. All pre-admission testing required by your medical team must be completed as soon as possible and ideally 2 to 4 weeks before your surgery. Your nurse will review any pre-admission testing with you based on your individual needs at the time of your follow-up phone call. As soon as you receive your prescriptions for your upcoming surgery, please drop them off to your pharmacy. They must be filled prior to your surgery. 1 week before your surgery, we ask that you begin drinking protein shakes. Please aim to drink 1 to 2 shakes a day in addition to meals. At this time, it is also important to ensure you have someone scheduled to drive you home after surgery, as you will not be allowed to drive yourself. Prior to surgery, you will need to remove any dark polish or synthetic nails. You may use a light or clear polish, or of course no polish at all, and feel free to do whatever polish on your toenails. Approximately 12 hours before your surgery, please drink the clear fast that is provided to you by your nurse. It can be consumed after dinner, but must be drunk before going to bed. Please take a shower the night before your surgery using Hibiclens or chlorhexidine. Please do not eat or drink anything after midnight unless you have been specifically instructed to drink clear fast by your nurse on the morning of surgery. When packing your hospital bag, it is important to bring all prescribed medications. You can find additional recommendations for helpful items to pack in your overnight hospital bag in the links below this video. We recommend taking a final shower again the morning of surgery, again using Hibiclens. After you shower, please do not apply any deodorant, powders, creams, or lotions with the exception of your face. After you shower, put on comfortable, loose-fitting clothing that does not have to be put on over your head. We ask that you do not wear any jewelry to the hospital. This includes rings, bracelets, necklaces, watches, facial and/or body piercings. Following your surgery, you will stay in the hospital for about 2 days. You will be directly monitored and cared for by the nurses in the hospital, as well as our physicians and physician assistants who will check in on you daily. We will have you up and walking within 24 hours after surgery to ensure you're prepared to head home and to reduce your risk of complications. The nurses at the hospital will provide you with an incentive spirometer and will teach you how to use it. Please take this home and continue using it for at least 2 weeks to help reduce the risk of pulmonary complications like pneumonia. The hospital will also provide you with a surgical bra and abdominal binder to wear after surgery. You will need to wear both garments 24/7 with the exception of showering until given further instructions from your nurse. Care instructions for your post-surgery garments, as well as instructions of correctly wearing the abdominal binder, can be found in the links below this video. Please review these instructions thoroughly prior to your surgery. To help protect your incisions and your post-surgery garments, we recommend purchasing 100% cotton t-shirts that are at least a few sizes larger than you would typically wear. You can cut these up the middle, put it on like a vest, and wear it underneath your bra and binder. Please be sure to pack this t-shirt in your hospital bag. You will be sent home with surgical drains to your breast and abdomen. Although slightly annoying, these drains help prevent fluid buildup in your body and decrease the risk of complications. Regular stripping of the tubing, as well as emptying and measuring the contents, should occur every 12 hours following the discharge from the hospital. To empty your drains, first wash your hands, and then you're going to strip the drain tubing starting close to the incision and move it down towards the bulb. Then you can simply remove the drain plug, pour the contents into a measuring cup provided to you at the hospital, and then you're going to record the amount of fluid in cc's and the time on your drain log, which can be downloaded and printed at home via the link found below this video. The fluid can then be discarded in the toilet. To recreate the drain suction on the drain, simply squeeze to deflate and then recap. The fluid collected in your drains can contain solid material. This is normal. Although tempting, please never attempt to rinse out the bulb or put anything into the bulb to try and remove the solid material. The color of the fluid will change as well. Typically, the fluid is bloody at first and then will become lighter over time. Some discomfort can be expected around the drain sites, and some leaking around the drain may occur as well. This is normal. You may shower with your drains in place and can use a lanyard, shoelace, or necklace to secure the drains while showering. It is important to ensure you wash around the drain sites using soap and water. Please never cut or detach any part of your drain, and if a drain falls out or gets pulled out at home, please do not put it back in your body. Simply place the bulb in a Ziploc bag and call your nurse during normal business hours, as this is not an emergency and you do not need to go to the ER. When your drain output levels are less than 30 cc's in a 24-hour period for 2 consecutive days, we ask that you call our office to schedule a drain removal appointment. You must bring your drain output record with you to the appointment, and should you forget, your drains will not be removed and your appointment will have to be rescheduled. Upon discharge from the hospital, it is important to continue walking and gradually increasing your time and distance each day as tolerated. We want you up and moving at least 5 times a day for a minimum of 10 to 15 minutes each time. With the exception of sleeping through the night, you should never go more than 2 to 3 hours without getting up and walking around a little bit. When you are resting during the day, it is recommended to keep your feet elevated when sitting, with your feet elevated just above the level of your hips. Your diet is extremely important when healing after surgery. Please be sure to eat foods high in protein to help your healing and high fiber to help the bowel movements, as well as drinking plenty of fluids. The consumption of alcohol is not recommended until 2 weeks post-op. Personal hygiene is also important during the recovery after your surgery. Please take a shower with your normal regular soap every day to keep your incisions and drain sites clean. We recommend showering with your back facing towards the shower, allowing the water to hit your back and neck and cascade over your shoulders to the breast and abdomen. Please take precautions to eliminate any direct water pressure to your new incisions. Likewise, avoiding the use of a loofah or washcloth on any incisions or wounds. As tempting as it may be, please do not take a bath or submerge your wounds until given clearance from your medical team. Lotions and oils may be used after a shower, but should not be applied on or near the incisions. Regardless of how well you feel after surgery, please refrain from any vigorous activity. Lifting anything greater than 10 pounds is not allowed for 6 weeks post-op. Repetitive motions like vacuuming, sweeping, mopping, dishes, and laundry should also be avoided for about a month, and at-home help with necessary chores should be arranged prior to surgery. Overhead reaching should also be avoided for about 2 to 3 weeks. Immediately following surgery, patients are not permitted to drive. You may resume driving after you're no longer taking narcotic medications during the day, feel comfortable wearing your seatbelt correctly, and are confident with taking evasive maneuvers to avoid a possible collision. Typically, most patients are able to resume driving on their own at about 2 to 3 weeks. Sleep is also an important part of nurturing your body while recovering after surgery. Although it may be different to your personal sleeping style, we recommend sleeping on your back and in a reclined or elevated position for at least 3 to 4 weeks. During your recovery, your body may look and feel different. Swelling and bruising is normal and should be expected. Abdominal tightness and bloating, decreased appetite, and fatigue are also very normal. Your newly reconstructed breasts may feel firm, and body stiffness and soreness are to be expected. Some patients may also experience an unscheduled monthly cycle or a brief period of depression. These are all normal, but if you become concerned, please contact your healthcare team. After surgery, if you experience severe pain or bruising, a change in your breast size, color, or temperature, increased swelling to your abdomen, fever over 101.5, chills, or excessive drainage from your incisions, please give us a call right away. Our office phone lines are always open. If after hours, please call our office at 210-692-1181 and follow the prompts to reach the answering service, and a physician or PA will return your call. If you are needing to schedule, cancel, or reschedule an appointment, please call back during normal business hours. To conclude this preoperative instructional video, we ask that you reference all of the below materials. You will find detailed information on drain care, wearing your abdominal binder, parking instructions, answers to commonly asked questions, and more. In addition, it is required that you sign the informed consent included in the email you received with this video link, and please return it to your nurse via email. At any time prior to your surgery, we ask that you please contact your nurse if you have any signs of a cold, fever, infection, or sore throat. We hope that you find this video informative and took the time to write down any questions you may have. You are welcome to watch this video as many times as you need, and we look forward to answering all of your questions and discussing your individual medications with you during your follow-up scheduled appointment with your nurse. Again, you will find that appointment information in the email you received with this video link. Thank you for your time, and we look forward to serving you at your upcoming surgery.